Advanced technology is nothing less than magic. This is a great quote said by Arthur Clarke. Today's topic is stethoscopes are obsolete in the medical museum. So, I am Sandula Abhinav and I am going to be speaking further motion. Let me start off by telling you that this stethoscope was invented 200 years ago. But as of now, currently there are two major problems with the use of this stethoscope. The first disadvantage is there is a high chance of error with the use of stethoscope. Even for an experienced clinician, sometimes a faint sound may be misheard or might not be heard properly, which can lead to a wrong diagnosis. The second problem with the stethoscope is it is only going to help us reach a differential diagnosis, after which we need special investigations like X-rays or CT scans to reach a confirmatory diagnosis and start the treatment. This is a very cumbersome process for both the patient as well as the doctor. So what is the alternative? Recently, a bedside ultrasonography technique has been started in the market, where the process is simpler, it is more reliable, and it is less invasive, and it is not going to cause any radiation. So the process works like this. You take the device and you place it over your neck. You'll be able to visualize the carotid artery, you'll be able to visualize the flow of blood in it, and you'll be able to visualize if there are any clots. Similarly, if you place the device over your gallbladder, you can visualize if there are any gallstones. And in case of like knee joint, if you're going to place it over there, you're going to visualize if there is any damage to the meniscus. So this is a very useful process because it is going to give us a lot more information about the condition. Even a less skilled worker is going to appreciate all this and reach a confirmatory diagnosis as soon as possible, and it is going to help us to treat the condition more possibly. So the final thing about this is the doctor-patient relationship is going to be better than ever, because the doctor is going to reach to a diagnosis very accurately and is going to give proper treatment. Thank you.
Since the first day as a medico, gently sung about a tattered collar, patiently transmitting rubs from rays as I struggle to decipher them. I am Vinu Malik of 2K20 batch from Government Medical College, Mehboob, and I am going to present my views on the topic. The stethoscope are set to become obsolete instrument into the medical museum. I choose to speak against the motion. I still remember the first time I heard the crackles and the bronchial press sound, which are typical of pneumonia. In most case settings, the stethoscope provide all the necessary hardware used to perform accurate and timely assessment, like in pulmonary examinations and for auscultation of abdomen to hear bowel sounds and roots. For assessing the pregnant movement, for the shortness of breath, they are convenient, rapid and safe due to no radiation. They are used for checking heart rates and BP as a backup. They are also used to detect the cardiac problems in the patients who require urgent surgery, because echocardiography is time consuming. They are also preferred to sense how the patient is recovering from the surgery by listening to the stomach. Portability is their main trump card. The physical examination with the stethoscope provide a strong patient and doctor relationship bond. The CT scan, MRI, ultrasound are quite expensive, heavy and less mobile, and they do not add to the skills of the professions. They are not afforded by every medical facilities and medical professions all over the country. There is a failure ratio for these digital devices. This is not to say that innovation doesn't come to the medical world, but when it comes something as simple as stethoscope, it is not going to overchange so easily. Much like needles are still used for drawing blood and dialysis machine still takes hours to fully work, innovations becomes slow while moving forward. Thank you.